Abigail is a 6-year-old child with cancer and Vincristine-Induced peripheral neuropathy. Abigail presents with limited active dorsiflexion bilaterally and a general weakness throughout her lower extremities as a result of her chemotherapy treatments. Abigail wears bilateral ankle-foot orthoses to assist with dorsiflexion positioning of the feet during gait. Without ankle-foot orthoses, Abigail displays lack of dorsiflexion and more pronounced hip and knee flexion to assist with foot clearance. Her balance is also reduced without the orthoses. For this session, the therapist decides to meet Abigail and her family at the local park. Abigail is encouraged to climb on the playground equipment to improve her general strength while participating in fun play-based activities. Abigail relies heavily on the use of her upper extremities to climb the playground equipment due to the weakness in her lower extremities. Climbing the playground rock wall is more challenging for Abigail, and she requests rests after each attempt. She again relies heavily on her upper extremities to complete this task. To address balance skills, the therapist uses the playground cement curbs as balance beams and encourages Abigail to walk with a narrow base of support. Abigail struggles to maintain the narrow base of support, frequently stepping off the balance beam. Abigail displays difficulty with the smoothness and coordination of running. Her running quality is impacted by her use of ankle-foot orthoses, which limit full plantar flexion, and her lower extremity weakness. Despite her weakness, Abigail is still able to jump independently during play. Abigail displays an inability to actively dorsiflex the right foot, even with assistance to stabilize the lower extremity. Abigail is able to actively dorsiflex the left foot. However, her weakness limits the active full range of motion.